Hello, I am Pamela Gatto, interventional cardiologist from Italy, Milan, and I'm here today with Rebecca Hahn and Victoria Delgado from USA and Spain, both course directors for Imaging Valves Madrid 2024. So, I don't know, Rebecca or Victoria, can you tell us a little bit more about this course and give us an overview of what will we see and do during the course?
So we have learned here in London Valves that imaging is key for all the structural interventions, but the most important is to diagnose patients with significant valvular heart disease, patients who have symptoms that may benefit from a surgical or transcatheter intervention. So at Imaging Valves Madrid, you are going to know everything you need how to use your imaging in order to accurately diagnose those patients and then treat them. And therefore is a course intended not only for experts on imaging, not only for experts in intervention, but for a very broad spectrum of cardiologists and physicians that are dealing every day with patients with valvular heart disease, and they want to streamline, to improve, to make it easier, the pathway for these patients.
Yeah, good to know that it's directed to all the community, so not only imagers, as we could expect, or interventional cardiologists. So Becky, can you tell us a little bit more about the topics and the organization of the course?
I think the course is very unique in a number of different ways. This year we're doing obviously tracks of aortic and mitral, tricuspid, and then other miscellaneous disease processes like mixed valve disease. But indeed, along that track, so we have these different topics and episodes, you'll also be able to follow from a lecture series where we'll talk about the diagnosis, but also management, and then move into the hands-on for that same episode, so for your aortic episode or mitral or tricuspid or other, and then be able to use simulators as well as the machines in order to be able to quantify valve disease better yourself. And so this is really meant to be a hands-on process as well. So you'll learn more about it first and then put it into practice as the second half.
So it looks really amazing and really useful for our practice. This is the second edition. What's new for 2024?
Yes, indeed. You have seen here a lot of innovation as well. The field is really rapidly moving, so we need to be really ahead of all the knowledge that is being built. So there will be the newest devices, the newest imaging tools that we are going to have in order to make more standardized the assessment of those patients who may be candidate for these new therapies. And we will have two tracks, right, as Rebecca was saying. One much more for the clinicians, where for them will be like an eye-opener. Hey, we have these patients, we are there to help you. Just make use of all the facilities that we are going to give you, either in lectures or simulations or hands-on, in order to be up to date in terms of diagnosis. And of course, for the interventionalists or for the imagers that are much more specialized in the cath lab, what is going to be new?
Yes, so it's a different track for that group who may already have some of the skills for diagnosis, but are now being needed in the cath lab to guide the procedures and to really understand how to use the machines effectively in the procedures. And so, again, a series of lectures, but moving on to the hands-on, which will allow them to gain the skills that they need to be able to guide these procedures. And so it's very exciting, actually. It's the program is just very fun for the faculty.
Exactly, and trying just to help a larger amount of patients to make sure that all these therapies are accessible to everyone.
Yes, I think so, and I think there will be a lot of opportunity of networking with very experts as you are. So thank you very much for these insights from this future course, and we hope to see you in Madrid.
For sure.
See you in
Thank you.
Madrid.
See you in Madrid.
Bye.